Have you ever wondered why doctors sometimes call erectile dysfunction, or ED, an early warning sign of heart disease? Most people think ED is only about aging, stress, or hormones. But in many cases, it can be something much more serious. It may be one of the first signs that the blood vessels in your body are not working properly. In fact, for some men, ED appears years before they ever develop chest pain, angina, or even a heart attack. Today, we're going to explore why this happens, what the science shows, and what every man needs to know to protect both his heart and his sexual health. Let's begin. An erection depends on healthy blood flow. When a man becomes sexually aroused, blood vessels relax and widen. This allows blood to rush into the penis and create an erection. It sounds simple, but it requires a healthy circulatory system. The blood vessels must be flexible, they must open properly, and they must deliver enough blood at the right time. But when blood vessels become damaged, narrowed, or clogged, blood flow decreases. And one of the first places this problem may appear is in the penis. Why? Because the arteries supplying blood to the penis are much smaller than the arteries supplying blood to the heart. The penile arteries are usually about 1 to 2 millimeters wide. Coronary arteries, which supply the heart, are often 3 to 4 millimeters wide. This difference may seem small, but it is extremely important. Imagine two water pipes. One pipe is narrow, and the other is wide. If rust starts building up inside both pipes, the narrow pipe will become blocked much sooner. The same thing can happen inside your arteries. A small amount of plaque may significantly reduce blood flow in the penile arteries long before it causes symptoms in the larger arteries of the heart. As a result, ED may appear years before a heart attack. Many studies have found that men with ED have a higher risk of future cardiovascular disease. Researchers have repeatedly observed that ED often develops 3 to 5 years before symptoms of heart disease become obvious. In other words, ED may provide a valuable warning window. It can give men time to identify hidden cardiovascular problems and take action before a major event occurs, but many men ignore the warning. Some feel embarrassed, some assume it is simply part of getting older, others look for a quick solution and never investigate the underlying cause. That can be a costly mistake, because ED is not always just a quality of life issue. Sometimes it is a vascular issue, and vascular disease affects the entire body. When blood vessels become unhealthy, the problem does not stay in one place. The same process that affects blood flow to the penis may also be affecting blood flow to the heart, brain, kidneys, and legs. This process often begins with the damage to the inner lining of blood vessels. Doctors call this endothelial dysfunction. The endothelium is a thin layer of cells that lines every blood vessel in the body. These cells help control blood flow, blood pressure, and clotting. When the endothelium becomes damaged, arteries lose their ability to relax and widen properly. Blood flow becomes impaired. Inflammation increases. Plaque formation accelerates, and the risk of cardiovascular disease rises. ED is often one of the earliest visible signs of endothelial dysfunction. This is why many heart specialists pay close attention when a patient reports new erectile problems. It may reveal information about the health of the entire vascular system. So, what causes this blood vessel damage? Several common conditions can contribute. High blood pressure is one. When blood pressure remains elevated for years, it places constant stress on artery walls. This gradually damages the delicate lining of blood vessels. Diabetes is another major cause. High blood sugar can injure blood vessels and nerves throughout the body. This is one reason why ED is so common among men with diabetes. In fact, men with diabetes often develop ED earlier and more frequently than men without diabetes. High cholesterol also plays a role. Excess cholesterol can contribute to plaque buildup inside arteries. Over time, these deposits narrow blood vessels and reduce blood flow. Smoking is another powerful risk factor. The chemicals in cigarette smoke damage blood vessels, increase inflammation, and accelerate plaque formation. Even smoking for a relatively short period can negatively affect circulation. Obesity contributes as well. Excess body fat is associated with inflammation, insulin resistance, and poorer blood vessel function. Physical inactivity can worsen the problem. The less active we become, the less efficient our cardiovascular system often becomes. But the good news is that many of these risk factors can be improved. And improving them often benefits both heart health and erectile function. Now let's talk about something important. Not every case of ED is caused by heart disease. Psychological factors can also play a role. Stress, anxiety, depression, relationship problems, and performance anxiety can all contribute to erectile difficulties. Hormonal imbalances may also be involved. Low testosterone can affect sexual function in some men. Certain medications may contribute as well. But even when these factors are present, it is still wise not to ignore ED, especially if it is new, persistent, or occurring alongside other cardiovascular risk factors. A proper medical evaluation can help determine the cause. And sometimes that evaluation uncovers previously undiagnosed heart disease. Many men are surprised to learn that they can have significant plaque buildup without any chest pain at all. Heart disease often develops silently. A person may feel completely normal while plaque slowly accumulates inside the arteries. The first symptom may be a heart attack. That is why early warning signs matter so much. ED may be one of those warning signs. Think of it as your body's check engine light. The light itself is not the main problem. It is a signal that something deeper may require attention. When ED develops, it may be an opportunity to investigate cardiovascular health before a crisis occurs. Doctors may evaluate blood pressure, blood sugar, cholesterol levels, weight, family history, and other risk factors. Depending on the situation, additional testing may be recommended. The goal is not simply to treat ED. The goal is to identify and reduce cardiovascular risk. Now let's discuss what men can do. The first step is to take ED seriously. Do not assume it is automatically a normal part of aging. Age increases risk, but ED is not inevitable. Many older men maintain normal erectile function. If ED develops, consider it a reason to have a conversation with your doctor. The second step is to focus on lifestyle changes. Regular physical activity is one of the most powerful tools available. Exercise improves blood vessel function, lowers blood pressure, improves insulin sensitivity, and supports healthy circulation. Even moderate activity can make a difference. Healthy eating is also important. Diets rich in vegetables, fruits, legumes, nuts, fish, and whole grains have been associated with better cardiovascular health. Reducing highly processed foods may also help. Maintaining a healthy weight can improve both heart health and sexual function. For many men, weight loss leads to measurable improvements in erectile performance. If you smoke, quitting is one of the best decisions you can make. Blood vessel health often begins improving soon after smoking cessation. Managing diabetes carefully is critical. Better blood sugar control helps protect blood vessels and nerves. Controlling blood pressure and cholesterol is equally important. These steps help reduce the progression of vascular disease. Adequate sleep should not be overlooked. Poor sleep is associated with higher cardiovascular risk and hormonal disturbances. Managing stress also matters. Chronic stress can negatively affect both sexual health and cardiovascular health. Now let's address a common question. Can medications for ED help? Drugs, such as sildenafil, can improve erections in many men. These medications work by increasing blood flow. They can be very effective when used appropriately under medical supervision. But they do not remove plaque from arteries. They do not cure underlying vascular disease. If ED is being caused by blood vessel problems, addressing the root cause remains essential. Using medication while ignoring cardiovascular risk factors is like putting tape over a warning light on your car dashboard. The warning signal disappears, but the underlying problem may still be there. So here is the key message. ED is not just a bedroom issue. For many men, it is a vascular health issue. It may be one of the earliest signs that arteries are becoming unhealthy. Research suggests that ED often appears years before a heart attack or other cardiovascular event. That makes it a valuable opportunity for prevention. If you or someone you know is experiencing persistent ED, do not ignore it. Use it as a reason to assess overall health. Talk with a healthcare professional. Check blood pressure, blood sugar, cholesterol, and cardiovascular risk factors. Take action early, because sometimes the body sends warnings long before a heart attack occurs. And ED may be one of the most important warnings of all. Thank you for watching. If you found this information helpful, please share it with someone who might benefit from hearing it. A simple conversation today could help prevent a serious heart problem tomorrow.